I'm Dr. Mimi Secor, nurse practitioner. I work at the Newton Wellesley OB/GYN practice in Newton, Massachusetts. I've been a nurse practitioner for 38 years, specializing in women's health. I'm also an educator, a national speaker and consultant, and an award-winning author, and I just love what I do as a nurse practitioner. I think what's really impacted me as a nurse practitioner is working with underserved high-risk populations. Women that I've worked with over the years that maybe are newly out of prison, that are homeless, that have no health insurance, maybe they're undocumented citizens, and providing them with cervical cancer screening, detecting problems before they become a statistic. That's highly emotional for me, very impactful, and one of the many reasons why I love being a nurse practitioner. I think what's so important for patients is to create a comfortable environment for themselves. And they can do that by, number one, finding a great clinician that they feel like brings out the best in them, that really they feel connected to, and then being an active member of that relationship, bringing a few questions, bringing a curiosity, and that willingness to really work in partnership. I see it so often with women that they don't really get the impact of how important it is to get cervical cancer screening. They don't know much about cervical cancer. They don't know much about HPV. They just, regardless of their educational level, regardless of their socioeconomic level, the research really bears this out that women need information. They don't have as much as maybe they think they have. We know that when we add HPV to the Pap test, Pap plus HPV, increases the chances of detecting a problem. So it increases survival potentially. It's a life-saving combination for women 30 and older. It's essential that women learn more about Pap and HPV. Well, the Pap test I've been using a long time, 38 years, so I remember the glass slide Pap, and then I also remember the exciting innovation of the liquid-based Pap and how much more accurate that test is. So we've gone from a good test to a great test, and I've been able to experience that with my patients. I think the one piece of advice I'd like to give women is to understand the importance of getting their screening tests, their Pap, with HPV testing. I have a sense from a lot of women that they're really not too concerned about cervical cancer. They don't realize 4,000 women die each year. They don't realize 10,000 women are diagnosed with cervical cancer. They don't understand that they may also be at risk. And so I just want women to know that they need knowledge, but they also need to be responsible in their health care.